Hello, Assalamu alaikum. Uh, we'll continue to talk about arrhythmia. Today, the first topic is sinus tachycardia. How to get the sinus tachycardia, how to approach the sinus tachycardia. The maximum heart rate per age is 220 minus the age. So 200, for example, if assume our patient his age is 20 years old, so 220 minus 20 is 200. So the maximum heart rate for 20 years old is 200. Above 200, we'll think about the other differential diagnosis apart from the sinus tachycardia. To approach the arrhythmia as general, we will calculate the heart rate, number one. Number two, we will see the QRS complex. Is it wide or narrow? Is it regular or regular? And there is P wave or there is no P wave, or there is many P wave. And we will put the differential diagnosis. We will collect information from where? From the strip lead. This is the last lead here is called the strip leads. So let's start by the calculating the heart rate. The heart rate, if it is the R to R, okay, if it is a rhythm regular, so we will calculate the heart rate by 300 over the number of the R, the number of the large QRS complex between the R wave. So we will see how many large square between the R wave. So here we have 2. So 300 multiplied by 2 equal 150. The second question we'll ask ourselves, it is narrow or wide? Here it is less than 2 small square. If it is less than 2 small square, this is narrow. So what is the differential diagnosis of narrow complex regular tachycardia? So sinus tachycardia, SVT, and atrial flutter with fixed AV block. Okay, so the second question will ask about self, what there is any P wave or there is no P wave. Okay, sometimes if the heart rate is fast, the P wave will be inside the T wave. Okay, and this is called camel hump appearance or camel hump feature of the R or of the P and T. Okay, so here this is the this is the P wave, and this is the T wave. Okay, and this is called camel hump, like the camel hump. So this is assuming this is a T and this is a P. Okay, it will become more appear here. Okay, and this is a P and this is a T. Okay, so this is regarding the sinus tachycardia, how to approach and how to treat the sinus tachycardia. Sinus tachycardia usually will treat the underlying cause. Okay, if the patient is dehydrated, we'll treat the dehydration. If the patient had the shock, we'll treat the shock. If the patient had the sepsis, we'll treat the sepsis. If the patient had the pulmonary embolism, we'll treat the pulmonary embolism. Okay.